So in art school over the past year, I've made this friend, let's name her Jessica. We had a couple studios together, so we had a lot of time to talk and get to know each other. And at some point, I learned a lot about how she came to be at Ball State and her past, and then I learned that she had PTSD. So my name is Ava Thompson, and today I'll be talking about the intersection of art and mental health. Now, all of the research that I'll be quoting is from either the Mayo Clinic or from psychology.org. But the Mayo Clinic describes PTSD, or post-traumatic stress disorder, as a medical condition or a mental health condition caused by the exposure to an extremely terrifying or stressful event, whether you're watching it or you experienced it yourself. Now, in art school, we have to do something called critiquing. So when a project is due, we bring our piece to our peers, we talk about it, explain what it's about, and then we get feedback from them. So one day, my friend Jessica brings in this piece that she's been working on, and it's really dark in color, but also the visual of it, and heavy, but it's also a really beautiful piece that was done very well. And as she described it to us, it became very apparent that she was talking about a lot of the experiences that had caused her PTSD that we had talked about in the past. Now, throughout all of humanity, art has been used as a form of history telling, storytelling, activism, or protest, or so many other things. But people who create art can usually tell you that there is plenty of space within the creative process for healing to come. But the discussion around art and mental health has become increasingly more popular over the past couple decades. Back in the 1940s, art therapy was first formally introduced. And then in the 1970s, it started becoming more popular in usage. Now, art therapy is pretty easy to just disregard, because when you think of art therapy, you think of drawing a picture for your therapist and then telling them what it means to you. But something else that can happen in our minds is think of these ink blots. Like, your therapist holds this up to you, they ask you what you think it means, and then they're gonna have this epiphany and tell you all of the things that are wrong with you and give you the perfect way to heal all of it. It's not really likely, and very debatable that that's even part of the process at all. But something that art therapy can help with is trauma. A lot of the time when, well, not even a lot, but sometimes when a person experiences trauma, what will happen is they will shove down the memory of that trauma so far that it's really difficult to access it and verbally articulate that experience afterwards. So what art therapy can do is integrate another piece of expression. So when you have a difficult time verbalizing an experience, instead you're creating another pathway to still address those really difficult emotions that are coming up or memories of certain experiences. Now, some of the benefits of art therapy can include help with your emotions, your moods, attitudes, blood pressure, and even sleep. It's also been shown to be very helpful with patients who are going through cancer treatments. Now, maybe art therapy isn't for you, and maybe therapy isn't something that you're open to trying at all, and that's okay. But everybody is creative in some way. It can be even just listening to music. It can be that you play an instrument, you can dance, or you can create more art like a drawing or a painting or things like that. But there's so many different ways that you can address the need for healing in these experiences if you just know how to access it. It doesn't need to be with a therapist. So use art as a way to express yourself, use it as an outlet, and use it as a way to heal. Thank you.